Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. I welcome you all after the Eid 2023, Eid al-Fitr, and I hope you people are in the best of your health. And as per we are learning in our MBBS fourth year, the ophthalmology, the topic of glaucoma. In this video, I will try to recapitulate what we learned and what we will be learning in the coming lectures, and I hope that in this small video uh, I may be able to transfer to you the important informations regarding glaucoma. So by definition, glaucoma is defined as a triad of three things. Number one, raised intraocular pressure more than 20 mm of mercury. Number two, typical visual field defects. Number three, optic disc cupping. These are the diagnostic signs of glaucoma. Basically, it is an optic neuropathy, and for undergraduate levels, it is enough for you people to remember these three signs, which is a triad of glaucoma. Regarding classification of glaucoma, we classify it on the basis of many types, like on the basis of age, on the basis of the status of the angle, on the basis of any other secondary diseases. So, uh, most importantly, we divide it into primary open angle glaucoma and primary angle closure glaucoma. Primary open angle glaucoma is a glaucoma in which there is no other ocular eye disease, and most of the times it is symptomless, and we usually call it a silent killer for the vision, because the patient does not come to know, as his central vision remains intact until the disease is very advanced and peripheral visual fields are affected, and incidentally when patient comes for some other problem to eye specialist, it is diagnosed as to having primary open angle glaucoma. Some patients complain of seeing the halos around the light and they come earlier, and you cannot label any case of glaucoma as open angle or closed angle until you have seen it through gonio lens, gonioscopy, and seen yourself the status of the eye. Regarding the treatment of a primary open angle glaucoma, we have got three main options. Number one are the intraocular lowering drugs, which can be given as a single drug or a combination, and we have to achieve a target pressure which is 16 in most of the patients, but if it is still damaging at 16, then we have to reset our target pressure, which can be lower than 16. Second option is argon laser trabeculoplasty, by which we apply small burns on trabecular meshwork to make an extra opening for the drainage of the aqueous humor. Lastly, if these things not work and intraocular pressure is still above our required target, then we go for the surgery and we perform a filtration surgery, which is called trabeculectomy. The principle of trabeculectomy is making an anastomosis between subtenon space and anterior chamber, so that the aqueous humors may easily drain out of the eye, and the intraocular pressure after trabeculectomy is usually in early 10s or around about 10. That is all about primary open angle glaucoma according to this small video. In primary angle closure glaucoma, there is no other ocular disease, but the angle on gonioscopy is closed or at any level. at one quadrant, two, three, or all the four quadrants. So it has got many stages therefore, and the first stage is the latent stage in which or intermittent stage in which the patient have spikes of high intraocular pressure, and he may present to you with sudden pain in the eye and sudden decrease in the vision. And if he presents at this level, you must do uh, the YAG laser or argon laser iridotomy, so that you make an extra opening for the intraocular pressure to uh, drain out. And you have to keep an eye on every patient of glaucoma, whether it is open angle or closed angle. And iridotomy is to be done in both eyes because it is the bilateral disease in most of the cases. And patient, you have to convince the patient to do the iridotomy in the eye which he feels healthy, because he may resist that why you are manipulating my the eye which is all right according to his perception. And if he sorry for the disturbances in the video, as I am driving and I am on a safe road, so I decided to make the video. As I usually have lack of time, so I have to make videos while driving on a safe road on a low speed. Anyways, most of the times the patient presents with when he is in a stage of acute rise of intraocular pressure, which we call acute congestive angle-related glaucoma. It is the fourth stage, and in this stage, the patient's presentation is with severe headache, nausea, vomiting, and when you examine the eye, you will find corneal edema. Pressure would be maybe more than 50, 60, 70, or maybe 80 or somewhat like this. On digital tonometry, you will find a stony hard eye, and you will have to admit the patient immediately. You would be giving intravenous 20% mannitol to decrease the intraocular pressure, because anti-glaucoma medicines would not work at this pressure. And after the mannitol, pressure usually comes below 30. And besides mannitol, you must start pilocarpine eye drops in both eyes, so that the pupil is constricted, and in anticipation of that, the angle will be opened up a little bit after this pilocarpine. If it is not permanently closed by peripheral anterior synechia, then it may open. After a few, maybe a couple of days, the cornea will become clear, because it was hazy because of imbibition of water from the pressure within the eye into the cornea. So you can also give the patient oral glycerine or glycerine in the form of eye drops, because it is somewhat hypertonic, and it, because of the equilibrium, it will pulls the water from the cornea and will make it transparent as soon as possible. So when the things are under control, you can start other anti-glaucoma medicines, and then you will go for peripheral iridotomy in both eyes, and make the patient come in the follow-ups. And If the pressure is well controlled, then it's fine, and if it is rising, you can add anti-glaucoma medicines like we did in primary open angle glaucoma. Start with a single drug, then you may add 2 or 3, and the rest of the management is almost like primary open angle glaucoma, and we have to achieve a target pressure. Uh, in this case, if medically it is not treated, we may try laser, uh, argon laser trabeculoplasty, or ultimately we may go to surgical procedure or filtration trabeculectomy we just talked. So this was a brief overview of main glaucomas, primary glaucomas. Uh, Regarding classification and secondary glaucomas, I would just say that according to age, you can imagine if a child is born with a glaucoma, it's called ophthalmos, or in the first year, if he develops, we call it infantile and senile and things like that. And regarding secondary glaucomas, in this video, I can only say that if the patient is having some other disease, for example, uveitis or subluxated cataractous lens, there's lens-induced glaucoma. So it is because of some other eye disease, so we call it secondary glaucoma. I will stop here as the video is long and people don't really like to see long videos. I hope inshallah to talk about this topic later in the next videos. Please write in the comments about this video, its contents, and what we can discuss about it. For now, I would like to say you Allah, say thank you very much for watching.